Today we are going to talk about meningitis, right? Before describing this topic, I would like to clarify some general terms related with central nervous system infection. So, some general terms that should be clear in mind is what is the difference between meningitis and encephalitis. We should know the difference between this term, and then we must know the difference between another term, cerebritis, and what is cerebral abscess. So let us talk about the first, meningitis and encephalitis. How do we really define meningitis? Meningitis definition is very simple. It is inflammation of meninges, but really it is not the exact definition. Let me make it more clear. As we know, let us suppose here is central nervous system and the layer which is protective layer which is intermittently related with central nervous system, that is called, the layer is called, this layer is called perimeter. Perimeter is surrounded by one more layer, this green layer called arachnoid matter, and this outer layer is called arachnoid matter, and the perimeter and arachnoid matter together is called two delicate membrane called leptomeninges. Now what is called leptomeninges? Why it is called leptomeninges? Anything which is delicate, delicate means thin membrane, we call them leptomeninges. Then outside that membrane there is a very thick membrane, and this thick membrane is called, this black membrane is called dura mater, right? Dura means tough, and this is very tough, and this diagram is not the anatomically correct, and it is just for functional diagram for understanding purpose. So basically CNS is covered by three layer. Yes, protective layer from outside to inside, it is dura mater which is fibrous and tough membrane. Then there are two delicate membrane inside, there is arachnoid matter and perimeter, and in between the arachnoid layer and the pia layer there is a tubular mesequa, and this mesequa is filled with cerebrospinal fluid. But CSF is also present in what? In these are lateral ventricle, third ventricle, fourth ventricle, and this is spinal canal. So CSF is present into the ventricular system too. CSF also moved out through a median foramen which is called foramen of Magendie, and there are two lateral foramen which are called foramen of Lasca. Now actually if we properly define meningitis, usually when we talk about meningitis we talk about inflammation of leptomeninges, not the inflammation of dura mater. So we can say meningitis means leptomeningitis. Conventionally when doctors are talking with each other and they are referring to meningitis, they are basically talking about leptomeningitis. But if dura mater is inflamed, then what that meningitis is called? Let me repeat, meningitis is divided into leptomeningitis, and leptomeningitis means inflammation of perimeter, arachnoid, and the CSF present in subarachnoid space. So this is called leptomeningitis, but when we say commonly meningitis, actually in medical community we mean leptomeningitis. If inflammation is related to dura mater and it is limited to dura mater, it comes from out from trauma or some organism directly enters the dura mater and initially involves the dura mater, and if there is predominantly the inflammation of dura mater, it is called patchy meningitis. PACHY, patchy, MENINGITIS, and this is not very common. Now, what is the real difference between meningitis and encephalitis? Actually, when there is generalized inflammation or diffused inflammation of brain parenchyma, it is called encephalitis. When there is generalized or diffused inflammation of leptomeninges, it is called what? Meningitis, leptomeningitis. So these two inflammation, meningitis and encephalitis, these both are generalized diffused. Now when we came to cerebritis, it is localized inflammation of brain parenchyma. It is localized inflammation of brain parenchyma. And what is cerebral abscess? Cerebral abscess is also localized. Now the question is, what is the difference between cerebritis and cerebral abscess? If the inflammation process is involved the parenchyma, of brain in the localized site, and inflammatory patches of the parenchyma is not capsulated, it is called cerebritis, and that is the real difference. And if there is inflammatory process, it will eventually lead to the liquefactive necrosis and localized pus formation with capsulation, then it is called cerebral abscess. The real difference between cerebritis and cerebral abscess is that cerebritis is basically localized uncapsulated inflammation of parenchyma of central nervous system, and cerebral abscess is actually the capsulated inflammation of brain parenchyma. So, if the cerebritis is not treated on time and it undergoes liquefactive necrosis and eventually pus formation, and around it the focus of cerebritis, actually the glycosides are there and they form the capsulation, then the focus of cerebritis is converted into cerebral abscess.